Okay, so if you've ever had to deal with chronic back pain, you know how frustrating and isolating it can be. It's this constant thing that just makes you wonder what is actually going on in there. So, yeah, let's dive into this because it's a really common and honestly, a very human dilemma.
I mean, you've probably tried it all, right? The stretching, the resting, maybe even painkillers. But when the pain just sticks around, there's always this one single burning question that starts to take over everything.
And that question is, what is wrong with my back? You just want an answer, don't you? Something concrete, something definitive, a black and white reason for why you're hurting. And you know what? That is a totally natural and logical thing to want.
So where do you go from there? Well, for a lot of people, that search for an answer leads them straight to the doctor's office. And they're asking for one thing, an image, a picture, something that can finally show them what they're up against.
And the thinking behind it is pretty simple, right? If we can see the problem, we can fix the problem. An MRI, it feels like it's going to be the ultimate truth teller, this high-tech machine that's just going to cut through all the noise and give you a crystal clear diagnosis.
And wow, the hopes we pin on that scan are huge. I mean, you're looking for that smoking gun, right? That one thing, a herniated disc, some degenerative change that just explains everything. You want a roadmap to feeling better. And just as important, you want validation. You want something that says, yes, this pain you feel every single day, it's real. Here's the proof.
But what happens when that simple picture isn't so simple after all? What if it tells a much more complicated, even conflicting story? Well, a recent qualitative study actually dug into this exact question. They talked to patients about their experiences with scans, and what they found, it's really fascinating. Just listen to this quote from one of the patients. They said, "Knowing the cause is crucial for working on it, for solving the problem." And that just nails it, doesn't it? It's this driving force of, just tell me what's broken so I can figure out how to fix it. The belief is that the scan is step one, the essential step one.
But then you get something like this from another patient. They said, if they were necessarily correlated, I should always feel pain, right? And boom, there's the conflict. This person has seen their scan, they know what's supposedly wrong, but it doesn't line up with their day-to-day life. They have good days, they have bad days. So if the scan shows some permanent issue, why isn't the pain there all the time? This is really the heart of the matter.
And this internal tug of war, it actually has a name. It's called cognitive dissonance. It's that mental conflict you feel when what you believe, my scan shows a problem, doesn't match your experience, but I don't hurt all the time. The study found this was a huge theme for patients, this uncomfortable gap between the scan and their reality.
So when does the desire for a scan get really, really strong? The study found it's not usually the first thing people ask for. It tends to happen when you've hit a wall. When the easier options like painkillers have failed, when the symptoms are getting severe and it's messing with your life. That's when it feels absolutely essential.
And here's a perfect example. This patient said, I did the MRI because the painkillers weren't working. I was worried because I was stuck in bed. You can feel the desperation there, can't you? They weren't just curious, they were scared. Stuck in bed, nothing's working. In that kind of crisis, of course an MRI feels like the only possible next step.
This brings us to another big finding from the research. The scan result is kind of a two-faced coin. On one side, there's hope and reassurance. Getting a clear diagnosis can be a huge relief. It validates everything you've been feeling. But on the other side, there's anxiety. For a lot of people, seeing those scary-sounding words, degeneration, herniation, it sparks a whole new wave of worry and fear about the future. And sometimes, that fear can actually get in the way of getting better.
Okay, so we're seeing all this conflict and confusion. And it's all building towards something. A really big reveal. A massive, kind of counterintuitive truth that might just flip everything you think you know about back scans and pain on its head.
So let's do a little thought experiment. Imagine we take a whole bunch of people who have zero back pain, none. They're active, they feel great, and we put them all on an MRI machine. What would you expect to see on their scans? A perfect textbook spine, right? Completely pristine.
Well, the answer might really surprise you.
It turns out, study after study has shown that tons of adults with absolutely no pain have scans that show disc herniation, degenerative changes, osteoarthritis, all the exact same things that are so often blamed for causing chronic pain, and yet these people feel totally fine.
And the reaction from a patient in the study when they learned this? It really says it all. They said, I don't know what to think.
I've never learned the opposite. And isn't that the truth? We're taught that if your scan shows a problem, then you must have pain. So when you hear this, it can be completely disorienting. Like, wait, what?
So where does all this leave us? It means we need to have a smarter conversation about this stuff, a more nuanced conversation, not just with our doctors, but with ourselves. It means we got to stop putting all our faith in that one single picture and start looking at the whole picture.
Here's the crucial point. A scan is just a piece of the puzzle. It's not the whole picture. Think of it this way. An MRI is not a painometer. It's a snapshot of your anatomy at one moment in time. It can't tell you how you feel. Your pain is part of a much bigger puzzle that includes things like your lifestyle, your muscle strength, your stress levels, even how your brain processes pain. So a perfect scan doesn't mean your pain isn't real. And a scan with some findings on it absolutely does not mean you're broken.
And this all leads to a final, and I think a really empowering thought. It moves our focus away from a static picture of what's wrong and onto the dynamic process of what we can do to feel better. So, what if we've been asking the wrong question this whole time? What if the most important question isn't what's on my scan, but instead, what's my path to feeling better? What if we started there?